Where's the blind for the window?
It's only a short trip to the doctor's.
She doesn't like the glare in her eyes.
Okay.
Leave it, Mum.
Might be important.
But Poppy's all ready to go.
2 seconds.
Please leave your message after the tone.
Hello, this is
Mum!
Could Gwen Clancy contact us to make an appointment? Thank you.
Who was it?
No one.
Now, it's quite normal for her to be a bit fretful for up to 48 hours, and she may even develop a slight fever.
What should I do then?
Keep her cool, give her plenty of liquids, and if she's really miserable, you can give her an infant paracetamol.
Right.
If you're really worried, you can always call us. And remember, a lot of babies don't even react to immunisations.
She's really good usually. She hardly ever cries.
That's because you always know what she wants.
Mum.
It's true. You anticipate her so well, you don't even know you're doing it.
Well, she certainly seems very content.
Really?
Yeah, I agree with your mum. I think you're doing a fantastic job.
Thanks.
Yes, it's Julie Maguire again. I'm trying to find out what's being done about Sutton Vale surgery. You are aware that the locum you put in there has walked out? Wait, so are you saying that you can't confirm that there's anyone in place there this morning? Would you please find somebody who can tell me and get them to call me back as soon as possible, please? Thank you.
I brought Greg in for a meeting. About Sutton Vale.
You know, the Primary Care Trust should be sorting this out.
They've known about the problem at Sutton Vale for ages. They said they'd visit Peter, and they haven't. What makes you think that they'll pull their finger out now?
I know it's all new and strange when it's your first baby, but you just have to follow your instincts and do what feels right.
I'm feeding her myself, she won't take the bottle.
Well, exactly. You can give her everything she needs.
Let's hope it stays that way.
Poppy's dad left a few days after the birth.
Mum!
It might help to tell the nurse.
I don't want to.
Some men have problems adapting to fatherhood.
He went off with someone else.
Oh, I'm sorry, that must be hard.
That's why Louise is living with me.
Leave it, Mum. She doesn't want to know.
I'd like Louise to see the doctor.
I've had my 6-week check and I'm fine.
You didn't tell her you were depressed.
I'm not depressed.
It's not your fault. It's not your fault. You didn't realise you were going to be on your own.
You said I was doing all right.
I'm not talking about the baby. I'm worried about you.
The doctor will be more than happy to see you, Louise.
No, I'm fine. I'm just a bit tired. I'll be fine when she starts sleeping through.
OK, well, you know where we are if you change your mind.
I wanted a quick word about my smear test. I've had a message to call the doctor.
Right.
It's usually just to repeat it, isn't it, when they don't get enough cells the first time.
I'll check.
Mum?
Yes, coming.
What are you talking about?
Nothing, love.
You're supposed to be supporting me, not ganging up on me behind my back.
I'll have to go.
OK, well, you call back when you can.
Sutton Vale surgery isn't our responsibility.
Peter Kendrick is.
Your duty only goes so far, Mac.
There'll be patients turning up there this morning with no one to treat them.
What's the PCT doing?
Oh. Look, I'll call them again, put another rocket under them.
Waste of time. We'll deal with it ourselves.
How do you mean?
We'll get a locum.
The PCT can do that.
Not for Sutton Vale, for here.
Here? Oh, why do I get that stinking feeling?
Hey, what do you think about starting a postnatal group for single mums?
What's that?
It's just they're really isolated and it's hard having a baby when you've got no one to talk to.
Oh, I'm full of admiration for anyone who can do it full time.
Exactly.
But you're asking the wrong person, really. I mean, I'm overstretched as it is, and believe me, I'm no expert.
Hey, what's happened to you?
How's our little songbird this morning then?
What?
We have a rival in the old vocal department, Faith. You've heard of the singing detective. Well, Dr. Clay here is our singing GP. We were in the bar last night and he was raving on about the green grassphone. Then he opens his gob and has the whole place in raptures. It was just like stars in their eyes, weren't it, Jim?
Blimey, you're not telling me that you turned into Tom Jones?
No, more like Alec Jones. You could just imagine him in his little white dress holding a candle.
Surplus, not a dress.
You used to be a choir boy.
I only did it to get out of rugby.
Bless.
Oh, Mac wants to see you, by the way.
I think you need a challenge.
Challenge?
Something to get your teeth into, test your initiative skills.
Huh?
So I'm assigning you to Sutton Vale.
What?
Well, temporarily. A chance to really make a mark.
Yeah, but why me?
Jimmy, I'm entrusting you with some serious responsibilities. I'd have jumped at it at your age.
Yeah, but I like it here.
Yes, well, I appreciate that, but in the interests of your professional development, I'm sending you to Sutton Vale.
Right.
Good. We'll get together what you need, and I'll see you in an hour, yeah?
She should be exhausted. It must be the jabs.
She'll go off the minute you feed her.
Oh, I fed her in the car park. I'm not breaking a routine.
Why don't I drive her around a bit more? Hmm? You go inside and have a rest.
You have one new message.
Hello, this is the Mill Health Centre with a message for Gwen Clancy. Could you contact us, please? Thank you.
So why don't we just send the locum to Sutton Vale and keep Jimmy here?
Because Mac wants someone he can trust. We could do with a locum anyway, take up the other half of George's hours.
Exactly, we have our own staffing problems.
Oh, well, thank you.
We are just spreading ourselves too thin to cover another surgery.
Well, decision's been made.
And what does Jimmy think about this?
Keen as mustard, you know Jimmy. Honestly, this damn mentoring scheme. I wish Mac had never gone near it.
I thought it was your idea.
Well, I didn't know he was going to get so obsessed.
Jimmy, supposed to be getting your stuff together.
Can't move.
Everyone's gutted they missed your debut last night.
Oh, you haven't told them, have you?
Oh, better than that. I've videoed the whole thing on my phone.
What?
Yeah, I'm going to download it on the computer. You know, thought I might have it playing as a bit of a talking point.
Give it here.
Now, all I need now is a picture of you in a frilly frock. I might give your sister a call, actually.
This doesn't even have a camera on it.
No. Got you off your backside, though, didn't it? Now, get yourself sorted. Get back in.
Dr. Woodson can see me today at 1:30.
Me and Poppy will come too.
You don't need to.
It could be serious.
It's more likely to be a problem with the test.
But the doctor's asked to see you specially. I've been reading a medical book and you're at the peak age for cervical cancer.
Thank you, Louise. That's very reassuring.
Look, I'm sorry, but I don't know what I'd do if you got ill.
How come it's me that gets shunted around? Why didn't Mac ask Elizabeth instead?
Jimmy.
She would have stood up to him, that's why. She would have told him where to stick his great opportunity. I don't want to be on my own with a list full of coffin dodgers.
Look, it's not Mac's fault that you overdid it a bit last night, is it? Anyway, mate, honestly, this is the best solution for Sutton Vale.
What, so you're not going to stand up for me?
Well, I think it's the ideal place for you to nurture your hidden talents.
What?
Well, go down a storm with the elderly generation. Good old-fashioned sing-songs, just the thing for raising the endorphins, isn't it?
Right, now we've had the results back from your cervical screening test. Now, it was clear, but there is a problem.
Precancerous cells, you mean?
No, that wasn't what we found. You have a chlamydia infection.
Chlamydia?
Yeah, you reported a discharge, so Nurse Walker ran a test. It's the most common sexually transmitted infection.
I got it through sex.
Yeah, yes. It's lucky, really, that we checked for it. Often women don't display any symptoms at all.
Oh, I'd no idea. I mean, it's not long since my divorce. I only slept with my husband till then.
Well, your sexual partners will need to be informed.
Haven't been that many. It didn't cross my mind to use anything. Obviously, I can't get pregnant anymore.
Unfortunately, the menopause doesn't make you immune to STIs.
Oh, I feel so stupid.
Well, don't. It's more common in women of your age than you'd think.
I always thought sexual liberation was something to aim for.
Well, liberation is fine. You just missed out on the safe sex part, and you are running a big risk if you don't protect yourself.
What happens now?
I'll give you a course of antibiotics. That should clear the infection. And I'm going to refer you to a genitourinary clinic. They'll check you for any more STIs and inform your sexual partners for you if you want.
I'll do that myself. We are both adults, after all.
Mill Health Centre.
Hello, this is Louise Clancy.
Oh, hi, Louise. It's Faith Walker. Is the baby all right?
Yeah, she's fine. I'm phoning about my mum. She said she was going to ring me as soon as she finished with the doctor.
Oh, OK.
Well, she hasn't yet, and I'm getting concerned.
Oh, I'll see if she's here.
Well, can't you tell me what's happening? What did the smear test say?
I'm sorry, Louise, but that's between your mum and the doctor.
But if it's cancer, she might try and hide it. I need to know if I've got to look after her.
I think you're worrying too soon.
Well, when should I worry then?
Everyone's always trying to keep things from me, like I won't be able to cope.
Look, I'm sorry, Louise, but I really have to go now.
But you try and keep calm and I'll get your mum to give you a call.
Mrs. Clancy, I've just had Louise on the phone. She's in a bit of a state.
Oh, I'm sorry.
I think she's worried about the result of your test.
It's chlamydia. You know that.
Yeah, I checked your result after you left this morning.
I can't tell Louise.
What do you mean?
She doesn't know I've had any relationships. You saw how sensitive she is at the moment.
You think she might be shocked?
More disappointed. We're a bit anti-men at the moment. It's only natural after the way Maxwell left.
That's her boyfriend?
Was, yeah.
Well, you're going to have to tell her something. At the moment, she's scared you've got cancer. Chlamydia might be a bit of a relief.
That must have been one of the most embarrassing conversations I've ever had. Well, yes, it was nice to talk to you too, despite the grisly subject matter. You will get yourself checked out by the doctor. No, I'm just as responsible. I should have asked you to use some protection. Oh, I have to go. Yeah, you too. Bye.
No precancerous cells at all?
No.
Would you tell me, though?
Yes.
I don't believe you. You never told me when Maxwell left.
You were in hospital with a new baby. I didn't want to ruin it for you.
So how is this any different? I've still got Poppy, and now you're going to leave me too.
Now, stop it, Louise. Stop it, stop it. Stop feeling sorry for yourself.
Well, you're lying to me, and I know you are. The doctor called you back for a reason.
I've got chlamydia. Okay. Are you happy now?
Chlamydia?
Yes.
I thought that was an STD.
It is.
I don't understand. Have you had sex with someone?
It was before you moved here. It's over now.
Mum?
It's okay.
No, it's not. You were used and dumped, same as I was, used by some randy old pervert who wanted a quick lay.
It wasn't serious.
Of course not. Because men are scared of commitment. Dad, Maxwell, they're all the same.
Hang on. Your dad was 30 years married to me.
What are you defending him for? We're on the same side. Look what's happened. The first date you go on after Dad and he's some sad creep who gives you the clap.
Right, sorted. Jimmy's got his feet under the desk at Sutton Vale and he's only in for afternoon surgery.
Just as well George has volunteered for extra hours then, isn't it?
Where's Charles Murray's number?
I thought we were handling this
The
ourselves.
symptom, not the cause. I want to know what the chief executive of the Primary Care Trust is exactly doing to get Peter back to work.
Be careful. Mac, you were pushing your luck when you chased him around the golf course.
It didn't work, though, did it? He gave me his word and hasn't done a damn thing. Well, he's not going to get away with it. Look, Peter can't put his problems on hold while Mr. Charles Murray tries to find a gap in his diary.
Number.
No, he finds it too easy to fob me off. I need to catch him off guard.
Oh, sorry, we're closed.
No, I was just passing. Can I make an appointment for later?
Hello, Andy.
Hey, we're back at work.
Oh, part-time, supposedly. Anyway, listen, I was going to give you a ring about baby yoga because Brecken's got a bit of colic and I've been reading how it stimulates the digestive system.
Not really my area.
I'm going to leave you to it.
Oh, well, listen, come through. I'll show you the book. It's amazing. It can really enhance the baby's development, you know, make them more alert and responsive. Brecken's favourite thing is when I dangle her upside down and spin her round and round, you know. The loop, the loop. You see, now you call yourself a yoga teacher.
George,
I didn't come here to talk business.
No, sorry, you came here to make an appointment. Well, you could fire away, because I could see you now.
Right.
Unless you'd rather see someone else.
No, it's just a bit embarrassing. I got a call from an ex-girlfriend who told me I could have chlamydia.
Okay. Have you noticed any symptoms? Any pain or burning sensation when you pass urine?
Possibly, yes.
Okay, and any discharge at all from the penis?
Yes. I thought it was down to a change of diet. I've been trying to treat it holistically.
Well, normally I'd be right with you, but I think in this case a course of antibiotics would be more quickly effective. It usually clears up in 7 to 10 days.
When I've given it to Gwen, that's my ex.
It is transmitted sexually, so one of you caught it from a previous partner.
There was someone a few months ago. I didn't use a condom for the same reasons as Gwen. She told me there was no need.
Well, I'm going to refer you to a genitourinary clinic just to be on the safe side. They'll help you trace any sexual partners. Blaming yourself isn't going to help, you know. But you really do need to protect yourself from sexually transmitted infections.
I just feel bad for Gwen. I met her as a student in one of my classes. A yoga tutor with an STI really doesn't go with the image.
Dr. Maguire.
You obviously haven't had time to call me, so I'm saving you the trouble. You are aware that the locum you put in at Sutton Vale has resigned?
It's all in hand. The inquiry is being held tomorrow.
Well, you're too late. Dr. Kendring is at my house now with his life in pieces. I am treating him for depression.
It's a great shame, but not everyone has the right temperament for the work.
He is a very good doctor who has failed due to total lack of support, which could have been avoided if you'd listened when I warned you last week.
We've had other priorities.
What is more important than a surgery closing down?
Well, as I've just told you, we will assess the situation and make arrangements.
Don't bother. I put in one of our doctors to cover.
That may not be the most appropriate solution.
The patients are getting the care they need.
That's not the point. You have no authority over Sutton Vale. You have no right to take any decisions.
And I wouldn't have had to if you had done your job properly. I've been waiting for you to take the lead, and all you've come up with are excuses. Excuses for total incompetence.
You've obviously become over-involved with your mentoring role. You'd better go now before you say something I won't be able to ignore.
Hi, is Gwen here?
Yeah.
You must be her daughter.
Yeah, that's right.
I'm Andy Clark. I used to teach your mum yoga.
Oh, yeah. Oh, come in.
Thanks.
Is she going to start up again?
I don't know.
She gave it up to help me and the baby, but I can easily cope on my own for one night a week. Well, she's always going on at me to go out and join a group.
Really?
Yeah. I used to be into kickboxing. You wouldn't think it, but I used to be quite fit.
Andy!
Hi. I came to see how you were.
Fine.
Good.
Why don't you go and see to Poppy?
What is it?
Nothing.
Mum?
Just give me some space, all right? I want to talk to him on my own. Louise? Louise?
You had sex with your yoga teacher.
What's wrong with that?
Is everything all right?
Andy, I think you better go.
Well, not on my account. I'll be out of here as soon as I've got Poppy's things.
Louise, you're being silly.
Can I help?
No.
I didn't mean to make things awkward.
It's not your fault. Louise is pretty fragile at the moment.
I'm sorry, I assumed she'd be coping without you now. But maybe we could go out and... Well, call me if anything changes.
Thanks.
He's doing it while I'm in hospital. Seems to know his way around pretty well.
This is none of your business.
Fine. I'll just pop out your grandchild and look after her like a slave while you pretend to be involved.
I am involved.
This is it. My world, here in this house. And all the time you've been carrying on your life behind my back. Do you know how that makes me feel?
You call Charles Murray incompetent?
He had a go at me for taking the initiative.
I told you were overstepping the mark.
Well, it's done now, and the bottom line is Peter is finally getting the attention he needs.
Louise. Louise.
I'll have to borrow the car.
Come back inside, please.
I've stayed here too long. I didn't realise I was cramping your style.
You've got nowhere to go.
Do you think I can't cope without your mother? I'm not the one who can't function without a man in my life. I'd like to make an appointment.
Louise.
You said the doctor could give me some pills.
Oh, right. Well, I'm glad you changed your mind.
I can't sit around feeling sorry for myself. I've got to find somewhere to live and get a job and earn some money.
Louise, why don't you come through to my room? Come on. Does your mum know you're here?
She's probably gone out with her boyfriend. He's about 20 years younger than her. It's embarrassing.
Really?
Like, what normal bloke goes out with a woman his mum's age? Oh, just the thought of it makes my skin crawl.
Is that why you're upset?
Upset? I'm not upset. She can do what she likes. I never asked her to help me with the baby. I would have been fine on my own.
She'll miss having you staying.
She probably hated every minute. I mean, she's only just found out about the chlamydia, right? She must have been going some right up until Poppy was born while I was stuck in hospital on my own. But she probably tried it on with Maxwell for all I know.
Poppy's dad?
Why not? She doesn't care about me, does she? Her love life's obviously far more interesting.
That doesn't need to affect her relationship with you.
She said she would always be there for us. She doesn't even need a man.
When you meet someone, it just happens.
But it isn't fair, is it? She's got her life sorted. Why couldn't I have him? When he first came to the door, I thought she'd been interfering. She's always going at me to go out and meet people. But I mean, I didn't mind. He was fitting on some reject who can't get a girlfriend. I thought I'll invite him in and we'll have coffee and talk, and then Mum might ask him to stay for lunch. I know I was getting ahead of myself, but men don't come round every day. And then she sent me away like when you're a kid and you see your parents kissing. I felt so blind, so thick for not understanding. But it isn't fair. I'm a grown-up and she's a grandma. I'm not supposed to be jealous of her.
Hello, Millhouse Centre. Oh, I'm afraid Dr. Maguire's busy at the moment. Yes, I'll get him to call you when he's free. Okay, bye. That was Charles Murray. He wants you to call him straight back.
Right, thank you, Sarah. See, bit of straight talking works wonders.
I'm fine, I'm fine. I just need some antidepressants.
Why do you think that?
It's all gone a bit wrong. And my mum started seeing someone, so I need to move out.
How are you coping with Poppy?
Poppy? She's what keeps me going. This isn't her fault, it's me.
How do you mean?
For being like this. Excess baggage that nobody wants. A useless lump of leaking milk with nothing to say for myself.
Louise, you've just had a baby. What you're feeling isn't unusual. A lot of new mums feel exactly the same thing.
Then why does nobody tell you that? Why do they let you waddle around thinking everything's going to be perfect?
I've asked myself the same question many times. But there are bits of having a baby which are perfect. You know, the first time you make her laugh, when she wants a cuddle from you and no one else, and, well, that wonderful sixth sense that wakes you up in the middle of the night a couple of seconds before she needs a feed. But a new baby can't magic a whole happy family. You're going to have to work on what you need to build around her.
But it should be there already.
Yeah, it should. But it isn't. But what you do have is a healthy, happy baby and a mum who wants to be involved.
It's down to me now. My mum's had enough of us.
Well, you've taken the first step by coming here and asking for help.
I thought that was giving in.
No, not at all. You've decided to do something for yourself. That's positive.
Where have you been?
The doctors. Sorted myself out with some pills.
Right. Well, good.
I'm sorry about before. I had no right to expect you to give up your life.
It's not your fault.
It is. I can't see past me and the baby right now. Everything shouldn't always be about us.
It should. It's not fair, love. You should be in your own place with Poppy, waiting for her dad to rush home from work.
Well, that's never going to happen. So I may as well accept that and get on with it.
I'm proud of you, you know. I'm glad I've had the chance to help.
I wish you'd told me about him, Andy.
There's nothing to tell. I'm not seeing him anymore.
But he likes you.
That's why I stopped going to his yoga class. I don't want to get into a relationship.
But you slept with him?
Yeah.
And it didn't mean anything?
No.
I see.
He's not married. We weren't doing anybody any harm.
Except yourself. Do anything to use protection?
No.
Do you know how dangerous that is? He could have had HIV.
It was the heat of the moment.
That's not an excuse. No condom, no sex. Every girl knows that.
In my day, we only worried about getting pregnant.
Well, times have changed. And if you're going to make this a regular thing, you're going to have to start carrying your own.
I don't want it to be regular. I like my evenings in with Poppy much better. Please, will you come back home?
We're going to have to manage on our own sometime.
I know you are. But not yet, eh?
I wanted to keep you in the picture regarding Dr. Kendrick. He is still staying with you and your wife.
Yes.
My colleagues and I are impressed by your commitment. He's lucky to have you as his mentor.
Anyone would have done the same thing.
Anyway, as you've taken it upon yourself to start treating him for depression, it seems the immediate crisis has passed.
What?
So we'll hold fire on any major decisions until we have a better idea of his progress.
But...
And with Dr. Clay holding the fort at Sutton Vale, it seems you've got all the bases covered.
That's a temporary measure.
So carry on with the good work and keep us posted.
Next here on BBC1, country music legend Willie Nelson is accused of murder. Monk investigates in a moment. Then your afternoon continues over on BBC2 with a peek inside celebrity homes. Through the Keyhole is at 3.